You had John Kennedy, the senator from Louisiana, going, no, president can't say they're not going to get back pay. That's not his job. It's what the Constitution says. You have Marjorie Taylor Greene rightfully saying, Jeffrey, and I know the district, we were talking about this yesterday, that she represents in Dalton, Georgia very well. I went up there every summer, visited my grandma. That is a district that needs Medicaid. Like the hospitals need Medicaid, the nursing homes need Medicaid. Like these Republicans are flying. I would just say the White House and those that are keeping the government shut down and want this fight on health care instead of, say, crime, they're flying awfully close to the sun politically.
May I ask a larger question, larger even than Mork and Mindy's role in the 1970s?
Yeah.
The larger question is, how did it come to pass that Marjorie Taylor Greene is a voice of reason on several fronts? On several fronts. Yeah, no, it's interesting. Like how did the White House kind of leapfrog Marjorie Taylor Greene?
She's listening to her constituents.
Yeah.
They're saying you're going to take away my health care.
Right. I will tell you there are a lot of people. That's a great point. I think there are a lot of people that aren't Jonathan, that aren't listening. They stay in their bubble in Washington. I saw it all the time, people that never flew home. But if you're Marjorie Taylor Greene, or if you're a politician representing my old district, or you're representing other rural sort of exurb areas, and you fly home, your constituents are going to tell you. And also your hospital administrators. Every time we were like trying to balance the budget, and we'd start talking about Medicare, we would have hospitals, administrators come going, okay, that's fine. You see this is how much our doctors are going to get hurt by it. This is how much our nurses, this is the wing that we're going to have, whatever. This is how pediatric care is going to get hurt. These are all the funding sources. So when they go, we're not going to cut Medicaid until 2028. No, the hospitals are being cut right now. So the services for Marjorie Taylor Greene's district, the services for constituents across not only red state America, but blue state America, those cuts come now.
Yeah, and pretty smart politics to put faces on this. In this case, for Marjorie Taylor Greene, her own children. She's saying, my kids' premiums are going to go up. And it's obviously reflective of what her constituents are facing here. And look, some of her thoughts on Epstein may be more because of the fever dream conspiracy swamps. But again, she's asking for transparency here. She's willing to defy the White House on a couple of matters. And I will say, there is some cracks growing here among Republicans that Thune Johnson and the administration don't entirely seem on the same page, because health care, they see it. This is becoming the issue that's breaking through in this shutdown that otherwise.
And in another 4 or 5, 6 years, they might break with him.
They may.
It's any decade now.
After he moves to Scotland and start golfing, they're going to write the book. How I saved the Constitution. But the thing is, it is, again, are they going to break? Maybe they're going to break, but Donald Trump, for 10 years, has been able to control the debate. He wants to debate something, he'll say something shocking, he'll tweet something shocking, and we all, the political world and the media, will follow him. Here, we're making a terrible mistake. For the first time, I think, the debate now is on health care, and Republicans lose that fight every time.
Every time.
Instead of on crime. Even with the things that we're seeing in cities that are just, you are like, hello, Supreme Court, would you like to do your job? Still, he wins when he's debating crime. He loses in the debate he's in now.
Yeah. And I mean, this is what Senator Patty Murray pointed out about these increases. In many cases, it's red states that are facing them. In many cases, the premiums will quadruple. I mean, these are insane numbers that people cannot afford. And what...
Wait. Go back to the first screen. And just for people that are listening on the radio, the top 10 states that are going to be hammered by the big, beautiful bill, by the slashing of the cuts, all red states. West Virginia premiums go up 387%, Wyoming's 382%, Alaska's 346%, Tennessee's 320%, Mississippi 314%, Texas 289%, South Carolina 285%, Alabama 284%, South Dakota 235%, and North Dakota 235%. The reddest of the red states, as we've said from the beginning.
This is throwing people out in the street. I mean, this is not whether or not some people can afford it. No one's going to be able to afford these in these districts that these members of Congress represent. And as Marjorie Taylor Greene points out, just like you remember from serving in Congress, They have family members who live there. They have friends who live there, and they hear from hospital administrators who live there. Jonathan Lemire.
More likely to break won't be Thune or Johnson. It will be Trump. Like Trump is very cognizant of these polls, and we've already seen him in the last couple of days open the door a little bit, say, well, maybe we should have negotiations.
And Mike, we've talked about this before as well. You look at populist movements across the West, Europe. What happens? There's the nationalism. There's the extreme right-wing views on so many things. But the one thing that never seems to fit is, you see it with Le Pen, you see it with so many others, they embrace entitlement programs. They do those two things because they understand they have to embrace the entitlement programs to keep working, working Europeans or working Americans with them. Here, that's why I don't see Donald Trump going, we're going to let them continue to suffer.
A couple of things. First of all, Marjorie Taylor Greene, along with every other member of Congress, is getting paid. She won't get shut down. She'll be paid during this thing. And she spoke addressing her constituents' needs, as Willie pointed out. She also spoke as a parent because her kids were involved, and their rates are going to go up. I am preoccupied, totally preoccupied with what happens going forward before the next pay period with this government shutdown. Does the military get paid? Probably not. Does ICE get paid? Is there a special cutout for ICE, which I suspect there probably will be? It's going to be interesting to see what happens there. But the largest scheme of the things is, Mika was absolutely correct pointing out at 6:01 this morning, the rise in health premiums can kill a family, can kill a family's planning for a year or two in terms of planning for the increased rates that they're going to have.
And Willie, there's a cascading effect to the people that work at the VA clinics.
Yeah.
Do they get paid? And when they don't get paid, you got vets that are talking to Republican members going, hey, wait a second, my wife needs to go, and I need to get this medication. I've been waiting 4 months to see this doctor, and now you're telling me because you can't do your job? I mean, been there, done that, seen it, heard it. It's not good, and it's not good if you're in a Republican district. Really more so than a Democratic district.
Yeah, we're standing in a 2-hour TSA line this morning, for example. This has all these cascading effects. It was interesting to hear yesterday, I think it was yesterday, Governor Andy Beshear of Kentucky, red state, Democratic governor. He's not a screaming lefty by any measure. Just saying, pairing this shutdown with the one beautiful bill, he said, I've got rural hospitals already shutting down, what you said. I'm looking out for my people. I'm not interested in the politics of this. I'm just telling you that this is very real for people in states red and blue, that health care is being taken away, that hospitals are being closed. People cannot get the services they need.
Right. And if they won't have town halls, because some are being urged not to, they're hearing it at this point because it hits so close to home now.